Well, let's see. I got a phone call from my district, one of several dozen today. People want to know what's happening in Washington. What has Washington done to you? Not for you. What has Washington done to you? Here. So he set out to begin the repeal of Obamacare or the Affordable Care Act. Oh, by the way, they're one and the same. It depends which way you're looking at this thing, but the repeal of the Affordable Care Act has dire consequences on Americans. Some 30 million Americans could be affected, according to the Budget Office, Congressional Budget Office. Or in my state, we're looking at maybe 5 million people could lose their health coverage, their insurance, as a result of that. There's $16 billion that immediately flows to the state of California for the expansion of the Medi-Cal program in California. That would be gone. And those people that are on that program would simply not be able to get care. It goes beyond just those that are in the exchanges, and the exchange in California is working quite well. Maybe 1.5 million people in California are covered through the exchange, and they have options in most every part of the state. In my part of the state, there are some shortcomings because services are not readily available, but there are 34 clinics managed by 9 different organizations that provide medical services in my district. Every one of those clinics rely upon Obamacare, or Affordable Care Act, for the services that they render. The Affordable Care Act disappears, repeal Obamacare, those clinics are out of business. And what does that mean? It means that thousands, literally hundreds of thousands of people in my district would no longer be receiving medical services through the clinics, through the Affordable Care Act's expansion, or through the Medi-Cal program. This is serious business. 5.1 million seniors receive savings on prescription drugs. 32.5 million seniors receive free annual preventions, health checkups every year. Also, it strengthens consumer protections. At least 85% of Medicare Advantage plans' revenues go back towards providing senior services. That's just for seniors. The budget resolution passed both houses. It's now in effect. Repeal the taxes that are associated with the Affordable Care Act. It's a lot of money, somewhere between $700 and $1 trillion of tax cuts. Who gets the benefit of those tax reductions? The top 1/10 of 1% would receive the great majority of the benefit, over $200,000 tax reduction for the super wealthy. The rest of them, the top 1%, get 57% of that $700 billion. And everyone else, for an average family, it probably amounts to maybe a tax reduction of $160. However, those are the people that are able to get their insurance through the exchanges. And so they're getting a really bad deal because the average exchange, for example, in California, is somewhere over $2,500. So this is the tax repeal. It is a massive tax cut for the super wealthy. Keep in mind, when people talk about repealing the Affordable Care Act taxes, what they're talking about is a massive redistribution of wealth in this nation and a furtherance of this income inequality that has been such a problem in our society and in our economy. The repeal of the Affordable Care Act does many things, most of which would be quite a problem for working men and women, for the seniors, for the elderly. And a good portion of that Medicaid population goes to provide long-term care in nursing homes for seniors who are not wealthy. But some people say it's 50–60% of Medicaid benefits across the nation wind up providing services in the long-term care facilities. Is that important to seniors? Oh, yeah. Is it important for children of seniors? You know, those people that are in the 40s and 50s, whose parents are in the 70s and 80s? They're deeply concerned about this particular issue of the Medicaid expansion being eliminated by a repeal of the Affordable Care Act, and then they wind up in a situation of having to take care of mom and dad, trying to figure out how to do it on their insufficient income. One of the things the Affordable Care Act does is to provide an opportunity for those who have pre-existing conditions, serious health care problems, for those people to be able to get insurance. And therefore, the risk is spread. Now, if the Affordable Care Act disappears, would this be part of the replacement? We don't know. Our colleagues on the Republican side keep talking about repeal and replace. We don't have a replacement plan yet, but what we do have is a probability of a massive tax cut for the very wealthy, and we're also looking at a chaos in the insurance system. So let's be aware of what is going on in Washington when we talk about repeal and replace, when you talk about Obamacare, which, by the way, is also known as the Affordable Care Act.